The nationwide doctor shortage is creating major concerns right here in the mountains.
It's a common complaint. There simply are not enough doctors, specifically primary care, to handle the number of people living here in western North Carolina.
News 13's Karen Zakalak found out it's a valid concern, and it's one that medical groups are trying desperately to fix.
Tucked away inside a small office in Asheville, you'll find Dr. Leslie Koretz. She's honest about the need she hears about every day.
Do you feel like there is a doctor shortage here in the Asheville area right now?
I would say yes. I have people that call me almost every day. I have people call looking for a primary care doctor. And oftentimes they've called around to several other practices and they're not taking new patients, or their next new patient appointment is months out. So when they call me, they're often surprised that the doctor answers the phone and that I can see them tomorrow.
She is taking new patients, but operates differently than a traditional doctor. It's what's called direct primary care, where patients pay a membership fee instead of using health insurance and get more access to care.
I know that there are doctors in Asheville, in the Asheville area, that are accepting new patients, so we are out there.
Dr. Catherine McLennan works for Lantern Health, another direct primary care, and is also taking new patients, but is well aware of the growing need.
We're absolutely in a deficit. I don't have an exact number for you, but essentially every county in western North Carolina is a primary care shortage area.
Dr. McClellan says one reason is burnout from a system that's simply not working.
Anecdotally, I have a lot of friends who've been in primary care who've been looking for an exit because it just doesn't feel like a sustainable career long term.
Even local hospitals like Pardee are feeling the frustration.
Why is it so hard often in this area to find primary care doctors?
So I think it's been that we haven't concentrated on that. I think now we have really decided that is a concentrated effort of ours to expand, and I think that's the reason.
Dr. Greg McCarty says before COVID, Pardee had 10 to 20 primary care doctors. Now there are 50, with plans to double that number to 100 in the next year.
Certainly there's a shortage of physicians in this region, and that's why Pardee has invested on expanding our primary care network.
Christy Sneller with Advent Health says they're also hiring, but admits they're having to get creative.
I do think you're going to start seeing more nurse practitioners and physician assistants used in the primary care world.
Dr. Brian Hodge works for MAHEC, the family medicine residency program here in the mountains.
What is MAHEC doing to fix the problem?
In the past 10 years, we've grown our programs significantly and also expanded where our footprint is, just to make sure that residents and students are getting training experience where there is the greatest need.
From just 4 residents in 1974, right now, MAHEC is training 218 residents and fellows. But Dr. Hodge admits our community needs even more.
For a majority of our residency slots, we usually see 10 applications to a single slot. And so with those types of numbers, I think that we would love to do more, but it does take educational resources to be able to not only do that, but make sure that we do it well.
Every doctor we talked with agrees this gap is hurting the health of the entire community.
There is a primary care shortage, and people are oftentimes going to urgent cares or emergency rooms for things that could be taken care of at their family doctor's office if they had one. So I think that puts big strain on the healthcare system.
Karen Zakalak, News 13.
And we checked with the State Medical Society for information on how many primary care doctors are currently practicing in western North Carolina. We never heard back.